Dementia, is it inevitable or are there things you can do to avoid it?
Oh, thankfully, I hope it's the latter.
All right, let's climb this ladder of dementia.
Welcome to Talking with Docs. I'm Dr. Brad Weening.
And I'm Dr. Paul Zalzal.
Forgot to introduce yourself there.
Yeah, right. So I'm going to talk about a report.
Okay.
A Dementia Prevention, Intervention, and Care 2024 report of the Lancet Standing Commission.
Dementia Prevention and Intervention. Say that 5 times
Prevention,
fast.
intervention, and prevention. It rhymes. This is a big report, okay? But this is a summary of what this working group put together to teach people how they can avoid getting dementia. Guess what percentage of dementia they estimate is preventable?
I'm going to say half.
50%, around 50%, not half, around 50% of dementias preventable.
Yeah.
The type of dementias we're talking about is Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, mixed dementia.
All the dementias.
Lots of dementias. It's a family of dementia.
Well, I think too, like 40 years ago, there weren't really task forces that talked about this for a host of reasons. People weren't sick, they didn't live as long, we didn't know as much about it.
Right.
And now, we're becoming overwhelmed. The stats that I read in Canada in 2022, 750,000 people were living with Alzheimer's or some other type of dementia. And it was listed as the number 9 cause of death, of all-cause death.
Guaranteed every one of our viewers knows someone who has dementia or knows someone who is dealing with a family member with dementia or may even have dementia themselves.
If you have some advice, actually, for people who are living with this or living with a family member, please share a comment, because this is a community that certainly can help support each other in a very difficult time.
Absolutely.
Okay.
All right, so we're just going to run through. They came up with 14 modifiable risk factors. Okay,
so we're not going through the whole report.
It's too big.
It's too big. Okay, so 14 modifiable risk factors. We're not saying that they're easy to modify. It's just like your diet or changing your lifestyle. It's to say, hey, have less stress. Hey, get more sleep. You know, these are modifiable.
Don't get dementia.
But it takes some effort, and you obviously do as many as you can.
Yeah, and you want to start early as possible, as you'll see with some of these risk factors.
Okay.
So let's start with the first one that they identified. If you have less education, you're at increased risk of dementia.
And obviously this is a very difficult one, because people don't choose to not go further in school necessarily.
No, and the definition of education is varied, right? Is it a formal education in school, or is it some courses you take, or something you teach yourself? Right. But in any case, get your brain working, keep your brain working, okay? It's not too late to get more education. There's lots of free online courses you can take in a variety of subjects. Watch Talking with Docs. That's educational.
Yeah, it is.
Really,
actually.
We're helping you.
Yep. Okay, I like that one. So number 2 is decreased hearing. And I suspect this is for a host of reasons, because you become less engaged, you have a harder time probably learning and things like that. So the way that this is modifiable, obviously, is get your hearing tested. I'm not exactly sure the recommendations right now. It probably depends on your symptoms. But as we get older, hearing aids certainly are a practical solution. They're much less kind of large now. Like they used to be really, really big, but they're very subtle nowadays. It's very, very common. Unfortunately, they can be expensive. Thankfully, some of the government plans do cover them. But yeah, I think getting your hearing tested and dealing with reduced hearing or hearing loss is really important.
Or just listen to Dr. Weening, because he talks loud.
I do talk loud. And then the other thing I'd say is, for younger people who don't have this yet, is wear protective hearing. So when you're running a chainsaw or the lawnmower, or even at concerts or your AirPods, whatever, respect your hearing and try to protect it in advance.
That's a good one too.
Yeah.
It's not just wearing hearing aids, but it's don't do the damage being around loud noises.
Yes.
The next one is very common. Many of our viewers have this, are dealing with this: hypertension.
Okay.
Hypertension was identified as a modifiable risk factor. Why is hypertension modifiable? Because you can take medications or do lifestyle changes that can bring your blood pressure down to a normal level.
And the reason that this matters for dementia is likely because of its effect on the small blood vessels that feed our brain.
That's right.
Okay, so that's number 3. Number 4 is smoking. Obviously, there are a zillion reasons to not smoke. We recognize that this is very difficult, takes multiple attempts at quitting, an organized strategy, but please don't start smoking. If you have started, please try to stop.
Would you say there's a zillion and one now?
Yeah, maybe.
Okay. The next one is, and nobody's going to like hearing this, is your body weight.
Yep.
Your body mass index, if that is elevated, this report identified that as a risk for getting dementia. So if there's no other reason for you to try and lose weight, let this be one of them.
Okay, very difficult to do, but very important to do for a host of reasons, obviously. Number 6 is depression. So people that are depressed have a higher incidence of Alzheimer's and other types of dementia developing over time. So you say, oh, hey, don't be depressed. Well, it's obviously not that simple. What's most important is that if you do have signs or symptoms of depression or know someone that does, get them to see their primary care doctor and get appropriate treatment.
That's the thing. Depression is treatable. You don't have to suffer on your own. It is treatable through a variety of ways. We're not experts in managing that, but we do have a lot of patients who do live with depression. And this has been identified as a modifiable risk factor for dementia.
And becoming more common, sadly.
And more recognized, more socially normalized. You see ads on TV. There's a lot of social awareness now. So just go get that treated if you think you have that.
Okay.
The next one is, none of our viewers suffer from this because we harp about it all the time. Physical inactivity. Physical inactivity is a risk factor for dementia.
Okay.
If you haven't had a reason before to get up your feet and jump around, now you do, okay? Get active.
And actually, I was listening to a podcast with my wife yesterday about a whole bunch of things about anxiety and depression, and this expert from Harvard was talking about something that you had said, sitting is the new standing, and about how...
Sitting is the new smoking.
Sorry, sitting is the new smoking, sorry.
Right.
Sitting is not the new standing.
This topic is dementia.
Right. So sitting is the new smoking, and you just have to get up and do something and start small. It doesn't have to be something a really high intensity or for very long. Just do your best to do something, get moving.
That's it.
Okay, number 8 is diabetes. So diabetes, obviously in the type 1 situation, is not particularly modifiable. That's very treatable. The type 2 is probably the more modifiable of the two. So trying to maintain a healthy weight and activity to reduce your chances of developing things like insulin resistance and type 2 diabetes. So if you do have it, try to modify it to get rid of it. If you have it already, see your family doctor and get it treated.
Get it treated. That will reduce your chance of dementia. Do I have to say the next one?
You do, actually.
Reduce your alcohol intake. It hurts me to say it because we talk about it all
But you're
the time.
kind of joking around. It's not like you drink a lot.
No, I don't drink a lot, but I know a lot of our viewers enjoy having some alcoholic beverages. And we have been seeing more and more evidence talking about how bad alcohol is for you. However, the number in this report was not as daunting as some of the other health risks associated with alcohol. Here it's about 10 drinks per week. If you can just keep it under 10 drinks per week, which is a lot more than the recommended amount.
But, sure. So specifically for dementia, it's higher. That's right. Obviously dose dependent. But yeah, we've talked about, we actually should do one specific video all about alcohol. It would make people sad, but I think it's important to know.
I mean, kill our channel.
I think we would recognize that the safe amount is probably 0, but then the lower amounts are probably still within safety for certain things.
So for this risk factor, for dementia, this report identified a certain number of units of alcohol, and it turns out to about 10 drinks per week. Keeping it under that will minimize your chance of dementia.
Right, okay. Number 10 is traumatic brain injury. Obviously, if you already have one, that becomes less modifiable, but it's really in the prevention. So wearing helmets for physical activity, avoid concussion-related activities, and just do your best to protect your brain. Our brains are very fragile inside of our thick skulls.
Right, to our high school students watching, the two of you high school students who watch our channel, maybe don't try and be a captain of the football team, be captain of the badminton team.
How about the 2 kids I saw going like 30 kilometers an hour on e-scooters with helmets? I'm like, how is that even legal? You have to wear a helmet, right?
I'm not sure what the e-scooter rule is, but I would imagine if it has a motor. You should have to wear one, I think.
Yeah,
we should look that
up. So protect your brain.
Yeah, that's by protecting your head.
Yes. This
one is a tricky one for some parts of the world. Pollution, air pollution has been identified as a risk factor for dementia. So, how modifiable is that? Move. If you live in an area, try and spend as much time away from pollution as possible.
Which we recognize is not always a practical solution. Or on the days when they warn that the air quality is very, very poor, stay inside, unfortunately.
I was kind of joking when I said move.
But I mean, obviously, if you can. People in the country are getting this probably a lot less frequently than city slickers.
City folk.
Okay, number 12 is social isolation. And this is a critical one. Lots of studies have shown that in order to successfully age, as well as prevent dementia, you need to stay connected, whether that's with your family, with your friends, with a purpose of some sort, volunteerism, a job. We need to stay connected and not be socially isolated. And our phones and the internet have really exacerbated this. And the pandemic highlighted it.
Get yourself connected.
Get connected.
Leave a comment. Comments is kind of socially
Sure.
engaging.
Be part of our
comments. Yeah.
That probably doesn't count, unfortunately, as far as not being socially isolated. Because people will use it and say, oh, I got lots of friends. I got like 1,500 friends on Facebook or something.
That's a start.
It's a start.
The next modifiable risk factor is vision loss. Okay, how's this modifiable? Well, wear glasses, go see your eye doctor, do what you have to do to keep your vision. And I think the vision loss and the hearing loss, they're kind of tied into the social isolation part of things, right?
Sure. I think it also could
kind of
decrease
related.
education, right?
Yeah.
You're going to learn less, you're going to read less, you're going to
read, Get your eyes checked, make sure your vision's good for a variety of reasons so you don't trip off the curb and break a hip. We see that all the time.
Yeah.
But in terms of dementia, poor vision is a risk factor.
Okay, the last of the 14 modifiable risk factors is going to irritate a lot of people.
You're irritating me with this one.
Okay, so elevated LDL or low density lipoprotein or high cholesterol. Essentially, we know that a lot of people don't believe that this is a real thing. Well, unfortunately, science has proven that it is a very real thing. Yes, cholesterol is necessary.
Damn you, science, damn you.
Yes, our bodies make it, but excess levels are dangerous and they're part of what leads to plaque in our vessels, particularly the vessels in our necks that feed our brains and can lead to dementia.
This was one of the later adds to this report.
Yep.
But yeah, high cholesterol. So however you want to do it, try and get your cholesterol lowered.
Now you know.
That's it, 14.
And it's a lot. It's obviously stuff that's all part of, a lot of it's part of living a healthy lifestyle. So making better food choices, being active, like we talk about, reduce your stress, get a good night's sleep, stay connected, be socially involved.
That's it. That's
Now
the report.
Now you know.